So thank you again for being here. I'm Patrick Blanshard. I'm the CEO of Sensory Tech, one of the founding partners. And we've got quite a diverse group today throughout the day. I'll speak generally relative to the entire day's events. We have people spanning all aspects of clinical care, from hospital management through frontline staff, of all the disciplines I could possibly name off. We have health system operators, managers who are planning and functionally taking care of large-scale planning for patients across large jurisdictions. We have representation from Canada, the US, England. We have investors in the room who are looking at healthcare as a major consumer of funds and as a big business relative to doing it better. We have legal representation in here. The law is incredibly complex around healthcare and reimbursement, and there isn't anything that you do that disrupts the model of care, if we can call it that loosely, that doesn't run into the law. And there's very strict and strong laws that are around patient rights and reimbursement to prevent fraud and all of these other pieces. So that's a big aspect of the space that we end up working into. For a little bit of housekeeping, everyone obviously found their way in. I didn't learn this beforehand. Someone's pointing to me, where are the washrooms? Someone needs to step out. By the elevator, so you can go basically back to the way. There's lots of nooks and crannies to take phone calls if you need to slip out and continue doing work. The last half of the day will be right next door to here, but I think we'll still have this room if people need to break out and chat. I would expect that there will be a lot of, and I heard some of them already, a lot of very interesting conversations. This is as much an opportunity for our organization to host people that are near and dear to us, as it is for us to allow those that are near and dear to us to get together and actually learn and exchange from each other. Usually, we see you individually. And in many cases, the things that we're working to solve with you are the same things that the person sitting beside you is working to solve. And that transcends borders. And that's probably been the biggest lesson learned that I've picked up in the last 10 years in this business, is the challenges that are being faced in downtown Toronto are not unlike the challenges in Detroit, Michigan, or in London, England, or in Sheffield, or the east of France, or in Germany. We're fundamentally bound by a few major drivers that are affecting our entire society. And one is the demographic curve that the entire Western Hemisphere post-World War II is up against. And I don't mean that in the negative sense, but as a challenge. We're going to be doubling the number of patients that we have, the number of citizens over 75 in the next 10 to 15 years. We learned today at lunch, Medicare is funded until 2020. It's not very far away in the US. And that means they're not funded after 2020. When you start to look at the demographic curve, and you look at what we expect as consumers of healthcare, and then you look at the inverse relationship to the people that are able to provide care, and then you look at the dollars that would be required for us to do, if we could, just do what we already do now, none of it adds up. It just doesn't add up. So the only way that we're going to actually be able to provide care that we all expect, that is financially affordable and can be delivered with the resources we have, is to do it differently. That's the fundamental. We're very excited to be a piece of that answer. By no means are we the answer. A lot of those other pieces are here as well. So throughout the day, I'll introduce other companies, other organizations doing things. We're very excited to bring both potential competitors of ours as well as other providers of what we see as those little pieces. And probably over the next 10 years, we'll see a major shift in the way healthcare is structured. And we'll start to see it in its nascent form spreading very quickly, because the need is going to force the change. And that's the positive investor marketing message, I would say. Right? We're up against a reality that's going to consume these types of solutions, whether it wants to or not. And on the other hand, as healthcare providers, we're going to be changing, whether we like to or not, because it's just not going to go the way we've always done it. So with that, just talk a little bit about what we're going to go through today. We've got some fantastic talks to be had today that I expect very diverse perspectives. We're all aware that Ontario, maybe not everybody's aware, not everyone's from Ontario, that an election's been called. That just, the writ has been dropped very recently, it was yesterday. What that means is that the majority of the people that would have come up here and spoke to you from a government perspective in an official capacity are often not going to be able to. That's just the reality of the way elections work as public servants. They're all here still. Most of them are here and are absolutely going to participate and be able to introduce themselves and be open to questions and to talk. But slight format change for us. We're going to have a very interesting talk from Deloitte from the healthcare perspective. London Health Sciences Centre is very well represented here for the Southwest LHIN, talking about a program called CC2H. I won't spoil the fun. I'll let them explain that. We're going to talk about virtual therapy wards in the general sense, heavily focused on what's happened in the Windsor area, in the Erie St. Clair then. Accountable care. We have the perspective from a U.S. healthcare leader to talk to you both about trends that we see occurring in the U.S. that are very relevant for other countries, and we're seeing it emerging in the UK in accountable care. We're seeing it emerging here in Ontario even. And we all hear as external participants from the U.S. health system the problems they have. But one of the amazing things is their speed to change and their speed to adopt and to adjust. And there's lots to be learned there. And then we're going to step over and we're going to have, I would suspect, a very lively reception where another 50 to 60 people are going to show up and be participating in the afternoon. So you'll hear me pop up there as well and do some introductions and highlight certain people that are in the audience. It would be awful for me tomorrow to talk to someone to find out that if they had just met with when I knew they were actually physically in the room. And that goes for people from within Ontario that very rarely get the chance to be in the same room together, let alone internationally. So I'll do some introductions to the group when we kick off the cocktail hour. So that's all I have for you right now. I'll pop up in between and probably help facilitate some discussions. But if I could introduce, actually, I'll correct myself. A number of you would not have actually seen what we do. You have heard about what we do, or you've been a participant in care being delivered. So maybe let's take a minute before Deloitte talks, just to walk you very, very briefly, not in the sense of pitching eShift or sensory tech, but just to give you some context to what it is in behind the scenes that's happening for some of the organizations that will be talking today. So we provide a virtual hospital ward system, to put it lightly. Think of it in the sense that we provide the electronic tools that clinicians can use that allow them to do their job outside of the hospital in a way where you would naturally see this type of care being delivered inside of a hospital. And I'm doing this for non-clinicians. The models of care you'll often hear being discussed today are leveraging a remote decision maker. So a remote clinician who's responsible for those patients. That clinician could be at home, they could be working from a hospital, they could be working from a clinical office. Regardless, they're not hands-on with the patient at that time. Who they're working through depends on the model. Sometimes they're working with an assistant, sometimes they're working through a peer. It depends which country as well. There's lots of different ways this is done. The reason that it becomes so significant is it delinks the geographic proximity of the patient to the decision maker. And it allows an expert to spread the resources over a wider range of space. And when you think of a hospital, you think of a big expensive building. It's very true. They're also very efficient at human resource management. The ORs are designed in a very specific way. The trauma centers are designed in a specific way. Everything is designed to very quickly leverage staff around the patient in a very by-the-minute method. When you move out to community, it's the opposite. One nurse, one doctor, one specialist has to spread their time and travel over maybe 8 to 10 patients in a whole day versus 60 to 100 if it was the other way around. So what we do is we end up basically turning the walls inside out of the hospital and allow that specialist to see the same number of patients that they would be able to affect, but do it out in the community. And there's lots of reasons why, and you'll hear about a lot of those today. So we're the glue that binds this model, and we allow a number of different participants to have effect on your care. Whether it's remote physicians, whether it's remote family, the planners that actually have to organize and structure the budgets, etc., a whole lot. A lot's happened for us in the last few years. We're actually over 10,000 patients now. Millions of hours of care have been provided. in different types of models. There's been significant outcomes of which you'll hear about today from some of the clinical partners talking about the type of results that they've seen to date, both medically as well as financially, that are very significant. You'll hear us talk a lot about the tools themselves. If you're interested, and not everyone will be, this afternoon there's an actual demonstration system set up on the other side. You can actually go over and take a look at what some of these tools look like. So if you're interested from a clinical perspective or from a data management perspective, or just even from an IT, what it looks like, what do the staff do and use, we'll walk you through how these pieces work. But functionally, think of them as the tools that the clinical staff use to give care, the tools that the managers use to organize the care, the tools that the administrators use to see what kind of success is being had, how are things turning out, or the tools that the geeks use to set everything up. Those are the 4 basic blocks. So with that, I'll turn it over to Dole.